Bond. Bonds, some common English name for bonds. English names cold, den bond, spine, braid bonds, rib, cold bonds, shoulder blades, thin bonds, kneecap, shide bonds. Anatomical name. Skull, anatomical name is cranium. Jack bands, mandible. Spine, vertebral columns. Brace bond, sternum. Brine, costat. Calves band, clavicle. Shoulder blades, scapula. Thin bones, femur and kneecap, patella. Cheese bones, tibia. Cráneo, mandíbula, columna vertebral, esternón, costat, clavícula, escápula, fémur, patella y tibia. Fracture is break in bones, one of the different type of fracture. Fractura es fractura o rompimiento de los huesos, son unos de los diferentes tipos de fracturas. Green displays prominence in pate, upper compound. A pathology of fracture. Fracture is a disease born of fatigue or stress fracture is due to the repeat minor trauma, for example, long distance machine of running. Fragment of fracture. When the fragment of broke bone held and joins together, the units. Union may be promoted or help by reduce the fracture. Replaces the fragment is the anatomical position if they are displaced. After reduction, excessive movement of the broad bone is performed by physicians, either external, for example, spleen of blade of paricast, or external, for example, a pin of plate of screen display fracture, which is on a redux may result is malunion, incomplete or incorrect union. No, the word reduce has several meanings in medicine. To make smaller, I think when better reduce the dose of your tables. In surgery, to return to anatomical position. A hernia can normally be reduced by manipulation. In chemistry, to remove oxygen and or aid it drops nitric acid is reduced age. Childhood. Milestone. Childhood is the period during which a person is a child. Is the end with puberty. The ones of sexual mastery. Infant is another word for a young child. Infance is the period from birth until about 5 years of age. The milestone is a child developed on the age as which they usually occur are stinted by 9 months, crawling by 2 months, forward by 18 months, walking by 18 months, talking to birth sentences by 3 years. Common infection disease. Mobile or rubella, common name is measles. Rubella, German measles. Varicella, chicken pox. Infection of parotids, mumps. Pertussis, whooping cough. Acute laryngomalacia is called scarlatina, scarlet fever, rheumatic fever, tetanus, lung jam, poliomyelitis, polio. Collis disease. A medical student has made some language notes while reading her test. Colic disease is a disease of the small intestine caused by sensitive to gluten. It can present any age but in infants it appears after waning up to cereals contain gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. They may be signs of malnutrition and they may be some abdominal distension. There is delayed growth and delayed puberty leader to show stir in adulthood. Sensitive to having a negative reaction to waning, changing the diet from meal only to solid food. Clinical feature, the symptom and sign of disease. Malabsorption, poor assumption. Malnutrition, poor diet, nutrition, agility, malnourished. Trigger rose strongly, distension, swelling, daylight, like that expect, failure sure when something that is expect does not happen. Sterile signs especially hate. The endocrine system. Except all deficits, and assets too much of deficits too later of circulatory hormones causes wide ranges of medical conditions, for example, hyperthyroidism and hyperthyroidism, where there is an set hormone, your hormones. One form of treatment consists of giving the patient something with inhibit the production of that hormones as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment be by replacement therapy, for example, injection of insulin in the treatment of type 1 diabetes. Doctors say suffering of type 1 diabetes are deficient in insulin. Negative feedback system. T TRH tiro tyrotrophin hormone is a secreted in the hypothalamus or trigger the production of TSH, thyroid stimulation hormone in the puberty. In the pituitary, TCH stimulate the TCH receptor in the thyroid to increase synthesis of bone T4 tyrosine and T3 thyroid, and also to relax stored hormone, producing great plasma level of T4 and T3. T3 feedback of the pituitary and PR the hypothalamus to inhibit TRAs and TCA secretion. Goitre. And a larger thyroid gland is called a goitre. The larger may be diffuse, involving most of the gland, or localized, limit to a particular area as in solitary single nodules. The increased blood flow of diffuse enlargements, for example, in Graves' disease, may give rise to a pulpit trill vibration filled with the hand and audible brewing noise. Her draws a stethoscope over the gland. A letter of referral. Mr. David, Dr. I've referred her to endocrinology. Dear doctor, I could be grateful if you will see this 50 years old, 50 years old woman who has lost 12 kilos in weight in spite of eating more than usual. She described herself as very tight, very active, and as first she doubts the weight loss was due to this. But more restless, she has developed palpitation, diaphoria, and heat intolerance. She has noted that her hands have tended to shake. Her symptoms suggest hyperthyroidism, and this was confirmed by examination. Real beliefs in a larger thyroid was sweating part and fine tremor of the hand. Over teens more active than usual. Palpitation awareness of rapid or irregular heartbeat, fine tremor, very sleep, involuntary movement, and heart intolerance, inability to cope with high temperature.